Good afternoon, ladies and gentlemen. I want to welcome you to the Population Health Committee. We'll now come to order. So at this time, would the clerk please call the roll? Okay.
Madam Chair Lady, you have 7 present. You have a quorum.
Okay. Thank you. Thank you, clerk. Okay. At this time, I want to welcome everyone, but I would like to take a personal privilege to thank Chairman Terry for covering this committee for me week before last when I was unable to be here. So thank you very much, Chairman Terry. You're always up to the task and taking care of all of us, so I appreciate that. And this time, does anyone on the committee have any personal orders? I do see one of my friends out there. I see Webster Bailey, who is the Executive Director for Metro Drug Coalition in Knoxville, Tennessee, where I've been very honored to serve on for several years. So thank you for being here and for all that you all do. Has anybody else got anything? Okay. Seeing none, then we will move on. We have a agenda today. And so we will begin by saying that House Bill 0026 has been rolled for a week. So without objection, we will go and start at the beginning of our agenda to House Bill 0104 by Leader Lambert. And it looks like Representative Raper is going to be bringing that bill for us today. So motion, I have a second. Okay. Are there any amendments on this bill?
I don't believe so.
Okay. Okay, seeing none, we will move right on, and the bill is properly before us. So please, Representative Raper, proceed with your brief description of the bill.
Thank you, Madam Chair and Committee. These are an admin bill that 14 of the 16 sections of the bill make very nominal changes in the code regarding the department that is being referred to as the Department of Disability and Aging, which had a former name of the Department of Intellectual and Developmental Disabilities. So those are all outdated terms now. So we've gone now to the Department of Disability. So 14 of the 16 bills just make very nominal changes as far as name change and getting it up to code. And then I'm going to explain real briefly the 2 areas that are not. One of them is Section 12, and it extends existing record keeping requirements to the Department of Disability and Aging to service providers, which requires important medical information to be maintained for a proper duration. And secondly, distinguishes service and support records, important medical information from other records that are being kept. This bill changes the duration of those records that are maintained to be current with state standards. And then Section 13 does a little more than just very minimal changes, and it clarifies that a conservator does not explicitly have the rights to disclose important medical information of a person receiving services from the DDA, but rather that authority must have been given by the court to do so. So at that point, I've tried to do a brief explanation. I'll open the floor to any questions you may have.
Okay, thank you very much. Are there any questions from the committee to the sponsor? Okay, seeing none, are we ready to vote? Okay, we're ready to vote then. Okay. Madam Clerk, will you read the vote?
Madam Chairlady, you have 8 ayes, 0 noes.
Okay, thank you very much. So the ayes have it, and we'll move on to full health. Thank you very much.
Thank you, Madam Chair and committee.
Okay.
Have a good.
Thank you. I do want to, I meant to mention this in welcoming and honor. Representative Gillespie is out today to not feeling well. So we wish him a speedy recovery and look forward to seeing him next week. So I know. So, okay, we are moving on to item 2, which is House Bill 0111 by Mark. You know what? I was thinking it was our other Martin up there. So, sorry, we have a motion?
Motion, second.
Okay. Okay, are there any amendments?
No, ma'am.
No? Okay, so this bill is properly before us, and so you can go ahead and proceed with your description there, Representative Martin.
Thank you, Chair, Lady, and Committee. Last year, a constituent brought to me a concern. She's a graduate student at the University of Tennessee at Chattanooga, and she was researching the increase in reported congenital syphilis cases. Between 2019 and 2023, there have been 548% increase of reported cases in Tennessee alone. Cases left untreated can lead to adverse birth outcomes, miscarriages, and congenital anomalies affecting the child's development. For babies who were born with congenital syphilis in 2022 and 2023, at least 53% could have been prevented with adequate and timely syphilis screening. I want to thank the Department of Health for helping push this conversation and prioritizing the health of our babies in the great state of Tennessee. This bill updates the frequency of Tennessee testing requirements like those in Texas, North Carolina, and Arizona, and it adds an additional syphilis screening between the 28th and 32nd week of gestation, as well as the time of delivery. And lastly, the department has added hepatitis B testing at the physician's discretion and a mandatory hepatitis C testing. The department or I can answer any question that you have, and I thank you for your consideration.
Okay, thank you, Representative Martin. Does anyone have any questions on the committee? Okay, Chairman Clemens, you're recognized.
Thank you, Madam Chair. I've received some concerns about this new required testing sample. Can we hear from the Department of Health as to what the real need for this is, or what the impetus behind this piece of legislation is?
Okay, certainly. So at this time, we will go out of session and hear from the Department of Health. Okay, just state your name and who you're with, please.
Absolutely. Good morning, Chairman, members of the committee. My name is Grayson Carter. I'm liaison with the Department of Health. Would you mind repeating your question?
I just received some concerns about the required testing, additional testing. So can you tell me what the reason for that is and what the need is to allay those fears?
So currently in code, mandatory testing is done upon the first appointment, or if the first appointment is at birth, for syphilis, rubella immunity, and hepatitis B. What we want to change for that first test is adding hepatitis C as well. For currently in code, a second test for syphilis and Hep B is done on or after 28 weeks if they're considered high risk. What we want to change is making it mandatory for all. And like Representative Martin had said, there's been a 548% increase in the number of cases of congenital syphilis reported just in the last 4 years. So how syphilis is a bacterial infection that can be treated easily with antibiotics, treat the mother and the child while still in utero. One dose, it's done, they no longer have syphilis. So we're trying to prevent those negative birth outcomes from not having the more frequent testing.
Okay, thank you. Thank you, Chairman Clemens. Does anyone else have any questions for Mr. Carter? Okay, Chairman Terry?
All right, thank you. And so to clarify, what we had in code was, it was a high risk B is what we had as well, or high risk syphilis. And then this, it'll be mandatory for them. And so at what we previously had was the physicians or the providers would have to justify that extra test. And now we're saying that we're going to go ahead and do that test so that we can prevent the infections at birth. Is that
Yes, exactly.
perfect? Thanks.
Okay, does anyone else have any questions? Are we ready to go back in session then? Okay, we're back in session, and thank you, Mr. Carter, for coming to answer these questions. At this time, I will recognize Representative Martin again to see if you have any follow-up or any other questions.
I would just appreciate your positive recommendation.
Okay. Question has been called. So at this time, we're all going to be voting. Okay. There it goes. Okay. Has every member voted? And does any member wish to change their vote? Okay, Madam Clerk, will you please read the vote for us?
Madam Chair Lady, you have 6 ayes, 1 nay.
Okay, the ayes have it, and so this bill will move on to full health. Thank you very much, Representative Martin. Okay, so we're moving on to item number 3. There's the other Martin there. So we reckon we have a second. Okay, thank you, Chairman Martin. We have a motion and a second. Are there any amendments on your bill?
No, ma'am.
Okay, so this bill is properly before us, and if you'll please proceed with a brief description of your bill.
Thank you, Chair Lady and Committee. This is House Joint Resolution 69. It's involving making Tennessee healthy again, pretty much. So a couple weeks ago, I spoke to our Health Subcommittee and mentioned the importance of legislators being leaders in this regard and taking on the ownership of health across Tennessee. What this is lays out a blueprint of how we as legislators can do things moving forward to make sure that Tennessee moves from 44th on the list on up into a better healthy outcome for all Tennesseans. A couple of components that we're looking at: reforming the food economy, some discussions around the SNAP program and how that works, finding ways to support our local farmers to incorporate them more into the local food supply, supporting lifestyle, medicine, and health education. So this is another key component. We've got a bill currently to address more physical education in our youth. And I think that's a great starting point to continue to push that and educate our young kids on the importance of physical activity and exercise. Unlocking health savings accounts to help utilize those for preventative measures. So using those for exercise, nutrition, things like that, allowing your HSA to do those things. Encouraging good governance, which is just helping regulate some of the FDA and USDA conflict of interest that we see at times to help those conversations. Of course, that'll come from the federal level down, but starting that process. Protecting Tennesseans from harmful substances that could be included in some of these as part of that discussion. And then again, leading by example in state institutions. So we talked about that as how we can set the standard from the state level, not telling somebody how to do it, but guiding them on the process and helping lead them towards a better life and outcomes. So that's kind of the process. It's just a roadmap to start the process to make sure that Tennesseans are thinking differently on healthcare across the spectrum. So with that, I stand ready for question.
Okay, thank you, Chairman Martin. Are there any questions from the committee to the sponsor on this? Okay, we have a question on the bill. So Madam Clerk, will you open up the vote for us? We're ready to vote. Okay, has every member voted and anyone wish to change their vote? Okay. Madam Clerk, will you read the vote, please?
Madam Chair Lady, you have 7 ayes.
Okay, thank you very much. Your bill will move to full health. So
Thank you, Madam Chair
Chairman.
and Committee. Thank you, guys.
Thank you. Okay, so let's move on to, I believe this is our final on our agenda today. It is by Representative Hammer, House Bill 0572. Okay, you have a motion and a second. Are there any amendments on it?
No, Chair Lady.
Okay, this bill's properly before us, so please proceed with your brief description.
Thank you, Lady Chair. I miss this committee. Hope y'all miss me.
We miss you too.
But this bill is a pretty simple bill. Worked with Department of Health and March of Dimes and some others on, and was really born out of looking at the Maternal Health Mortality Committee. If you haven't a chance to read that, it's a really great report the department puts out every year. Unfortunately, last year, the last reported year, 2022, 55 Tennessee moms didn't survive pregnancy, and 76% of those were preventable. But really, all this bill is doing is empowering the department to make some information available to the, mothers and mothers' family at discharge about post-birth warning signs, including symptoms and available resources prior to discharge of birth. I was joking earlier. I was remembering my experience with my first child leaving the hospital. I remember looking over at my wife saying, do we get to leave with this thing? We don't even have a license. Like, what do you do? Just thinking how overwhelming. We didn't have a bad health event, healthy pregnancy, had two parents there. And I can't imagine going through a really awful situation and being a single mother and having to just be so overwhelmed with it. And so this is a really simple thing. It was based on some legislation that Louisiana did last year, and was really looking at this issue of what are some things we can do that make common sense, that don't cost money, that really can help move the needle. And so providing some life-saving information and resources upon discharge really seems like a right way to do. And I'm happy to take any questions.
Okay, so with that description, are there any questions from the committee? Okay, Chairman Terry, you're recognized.
Thank you. Appreciate you coming before us. I did have a question on this because it's not real specific on this. Normally on discharge, there's discharge instructions and discharge planning. If you've had a C-section or something along those lines, they'll give you information about that, whether, how much bleeding or spotting to expect, things like that.
Yeah.
And I know that the department has some of this information. Is this something where you expect that the department is going to have to change much of what they already have there on the website? Or, and then secondly, it's very generic. It just says post-birth warning signs. There's no specifics on what they have to say. Obviously, someone that's had a vaginal delivery versus a C-section, some of the planning is going to be different. How do you, anyway, just can you give me some more specifics on this?
You're recognized, sponsor.
Thank you. Chair. Yeah, that's a great question. And that was part of the design. I just wanted to, speak at a high level, give the department the flexibility. I don't want to speak for the department, but my conversations with them, I was kind of thinking about more of like a public health awareness type of thing, about the posters and the different resources they can get from federal, from ACOG societies, et cetera. And they viewed their role as really being more of a clearinghouse for this information, not so much providing the in-depth clinical stuff that they would be doing normally from a discharge, depending on what high risk factor, et cetera. But this is more of a, you think about it, the different warning signs, heart conditions, mental health, infections were the leading causes of that. And we're not even getting into the mental health postpartum thing. So we really just wanted to guide the department and allowing them to have a plethora of resources that can be available to the hospitals that they can pull down and use as part of this discharge planning, but keep it at a high level so they have the capacity to create these things. And a lot of it's materials that they have already, but also give the flexibility for the doctors and the hospitals to utilize specific information related to that patient's condition.
Chairman Terry.
Right. Thank you. Thank you. So it'd be similar to like if we were giving out like the 988 or 911, they would be essentially giving out their potentially giving out their website, and then they have the flexibility to put the information on there for them. But you're not directing the OBGYNs to what they have to say or anything like that.
No.
Okay. That's what I want to know. Thanks.
Sorry. Yeah.
Okay. Okay. Does anyone else on the committee have any questions for a sponsor? Okay. Seeing none, looks like we're ready to vote. So Madam Clerk, will you open the vote, please? Okay, has every member voted? Anyone wish to change their vote? Okay, Clerk, will you please take the roll for us?
Madam Chair, you have 9 ayes, 0 nays.
Thank you, committee.
The ayes have it, so the bill will move forward to full health. Thank you very much. Okay, that looks like that ends our agenda for the day. Does anyone have anything they need to announce, whatever? Okay, at this time, we will stand adjourned.